Sorry.
No,
Thanks, everyone. So I guess I just wanted to talk a little bit about my own personal experience, and also sort of to the wider experience of other people that might be that might have chronic health issues and might be impacted by heatwave events. So I've been a type 1 diabetic for over 25 years. I have quite a number of complications, which is general run of the course for someone that has diabetes. I'm on 5 injections of insulin a day. Those medications have to be kept at a cool temperature. If anyone sort of understands any of the medications out there, a lot of those are sensitive to heat as well as light. There are days when I actually have to think about whether I need to be inside more. There are days where I have to think about, I just came back from a road trip where we took a cold pack as we were travelling through the States, because if you're in a car for a long period of time, as you know, medications or anything can heat up inside that car. I also have like a pre-kidney disease condition which requires filtration. Hydrating is really important. And it got me thinking about, on the hot days, like the day that we had on Monday, I just stay inside. But I'm lucky enough that I can stay inside in a house that has really effective ventilation. I can afford to have the air conditioning on at the moment if I want to. That the power isn't being adversely impacted with regards to heat, so I'm okay. But that wasn't always the case. So when I was sort of as a student, I was on a part disability payment, living in public housing, and so going out on a day like Monday was a difficult thing for me to do. Not only do you have to keep medications cool, but the way in which your body reacts to the insulin that you're injecting into your stomach on a hot day can really be impacted. So there were a lot of other things that I had to consider before I left the house on a hot day. When I think about other people that can be adversely affected by this, and we often talk about the elderly, which I think is a really important place to start. If you're having to wait at a bus stop, and as you said, there's no real coverage, we know that infrastructure gets impacted by these heat events. So who hasn't been stuck at a tram line because the tracks are too hot, or the trains have been delayed? Those sorts of things can really impact on someone if they're just standing out in a hot summer's day and they haven't had a lot of hydration for a long time. Now that can be for everybody, but for people that have these added issues, whether they are older or they have some sort of illness that's going to be greatly affected by that, it can be a really dangerous time. And then I think about sort of what governments need to do, and I was just having a conversation with someone else about this. I think the greater government doesn't necessarily want to address these problems because it means they have to address a lot of others. It means they have to think about things like service delivery in hospitals, for instance. How do they deal with that when there's a whole bunch of people and there's already 4-hour-long waiting times? They have to think about how they effectively manage emergency services. I was just saying to someone else that living in Altona, right near the beach, on those hotter days, suddenly there's a whole heap of other people that come to that area. With that, you need to have the emergency services relatively close by, because you've got hot people, you've got potential health issues that can arise. How are governments going to deal with that? But what I actually like from what I've seen out here is that there is a bit of a community response, and that's some of the stuff that we also forget. No, it shouldn't always be up to the individual to check on their neighbour or for a council to actually put certain things in place. We need to start pushing at a federal level for them to change these things so that it doesn't all just rely on us and the individual. So that's all I really wanted to say. I think there's lots of further conversations that we can continue to have, and I'm happy to talk to anyone as we go along our walk. Thank you. Who's next?
Thanks, Tess. So thank you for that. The next speaker I'd like to introduce is Fida Masri. She's the senior team leader at Melton Ambulance Victoria, speaking from the perspective of the ambulance services and some of the experiences that they endure and high demands of their services throughout hot weather.
Good morning, everybody, and thank you so very much for having us here today. I think I'd like to just start off with saying that probably heat stress is probably one of the greatest causes of death to patients, more so than natural disasters within Australia. And it's quite an insidious, pretty not benign, but certainly not something that communities take seriously. So I just wanted to start off by saying it's actually quite insidious, and someone that's young and fit doesn't necessarily consider it to be quite serious. But for the very young and for the very old, that's the cohort of, or the group of individuals that we're really targeting with our heat messaging this year and every year, so to speak. From an Ambulance Victoria perspective, we find areas or times of heat stress, we don't necessarily see a demand in our services on the first day. So normally it's normal operating business, people are relatively well prepared, you know, they put the air conditioner on and they stay indoors and they go about their daily business. But it's generally the second and third day of a heat wave that we find a spike in our demand for services. And it's the majority of the time it's for our elderly residents in the community, as well as our very young children, as well as those community members more at risk, so the ones with chronic diseases or illnesses, or poorly managed patients with mental health issues. They're the ones that we see really rely on our services and a peak or a spike in demand. Our previous speaker, Tess, articulated that it's a community obligation to really check on our neighbours, making sure that they're okay and they're well looked after. In terms of simple messaging that we can try and get across to all our community groups, look after your neighbours, make sure that if you can, do simple heat reduction techniques within the home, so shutting blinds, closing windows, making sure you're well hydrated, turning on the air conditioner if you can afford to run it. And that's one of the issues that we're finding, is that our elderly residents or disadvantaged cohorts of the community can't afford to run an air conditioner for 2 or 3 days. So by the third day the air conditioner's off and the house inside the house can actually be hotter than the outside of the house. We find that with our elderly patients as well, they don't necessarily adapt to the conditions. So I've walked into patients on the third, fourth day of a heat wave, and they're dressed like they would be in the middle of winter. You know, 4 layers of clothing in a hot room that's probably about 35 degrees, and they're presenting with acute heat stress and heat stroke. And so we really need to educate the community to dress appropriately, not do things in the middle of the day to time their activities, and if so, cancel them. Stay somewhere cool. Make sure that we check up on our elderly relatives and neighbours and colleagues, and to really look after ourselves. It's just really simple messaging that Ambulance Victoria is trying to get out there.
Thank you. We heard that same story, from another perspective from the police, saying that every time they walk into a house, even after the outside's cooled, the inside's still going. That some residents in our area are frightened and scared to opening their windows because of incidents of crime or what they perceive to be, an unsafe thing to do. And so releasing the air in their house is then something they choose not to do or not to fuss about, resulting in ill health and other things. So there's lots of misconceptions and lots of influences that can affect how people behave throughout the heatwave or how they prepare, but if we can raise a message and get out there, then maybe we can challenge and change a little bit of that using different strategies to do so that are appropriate for community. So in this time and space now, we actually have a little bit of a moment to walk around the bus stop, if you like, going up and down. So I'd invite the journalists if they'd like to speak to any community members, or if you would like to speak to community members and gather their interest around heatwave health. We'll stay here for another 10 minutes. this is the meeting space. So when you kind of see a wave or hear us speaking again, we'll make a move on to the Uniting Church. But we do have a little bit of time to explore the bus stop in the Sunshine area.
Can I just make a comment? Is that okay?
Yeah. Thank you very much, and great speakers. And I just want to sort of reflect on the urban form of this, of the bus interchange and the station. Who remembers what Sunshine Station used to look like? Yeah, it was very bad. It used to just be a subway and then a platform. So this got upgraded as part of the regional rail link in 2013. And what we weren't going to get this bus interchange. We weren't going to get a new station, but council, through its efforts in urban design advocacy, succeeded in getting this. We worked really hard with the state government to get this, but because of the Metropolitan Airport rail link coming through here in about 3 or 4 years' time, this upgrade costs $55 million. Yeah, and we try to make this as shady as we could, but a lot of things have changed since then. Like council's got an urban forest strategy. Council's got we're part of the Greening the West movement, and in preparation for the new station that's going to be designed here for the Metropolitan Air Rail Link, it's probably going to be a $500 million station. So to give you a sense of scale, it's probably going to be like Southern Cross. Bonk. But a key thing in we've got urban design principles that have been adopted by council, and the key thing in there is that we want this building here, we want this station to be the greenest, coolest station in Australia. That's what council wants. So it picks up on all these points about we want people to use public transport, we want people to be as active as they can be on those hot days, and if they do have to catch public transport, we want 50 to 60% canopy cover in the public realm. So that's a bit of a story about this, and we hope that it's a much greener, cooler place once the airport project kicks off. But that's a negotiation we have to have with the state government. Sorry, just to give you a bit of a flavour of what's going on in this area. Thank you.
It's Adrian Gray, Manager of Urban Design at Brimbank speaking.
All right, thanks everyone. So free time.